Okay, morning everyone, welcome back. Very excited today to be introducing Prof. Olivier, who is a professor of philosophy at the University of Fort Hare, as well as visiting professor at the University of Bayreuth, and co-founder and co-chair of the Center for Phenomenology in South Africa. So in addition to this, he's also the author of Being in Pain, the main editor of the anthology Phenomenology in an African Context, and editor and co-editor of several special journal issues, most recently Philosophy and Laughter for the Southern Journal of Philosophy. He's also published numerous peer-reviewed articles and book chapters on topics relating to, I'm so sorry, everyone, phenomenology, philosophy of mind, and African philosophy. So I'm not going to talk too much about what he's going to be speaking to us about today. But in summary, he's going to be speaking about humor and pain and how we should think philosophically about the empirical observations that humor can be used effectively in pain treatment. And he's going to try to suggest a possible answer to this question. So take it away, Abraham. Thank you so much.
Thank you very much, Jenna and Andrea. The last 2 decades have seen a significant rise in the number of empirical studies the effective use of humor in pain treatment. Skevington and White say notably, I'm quoting, although it seems an anathema to associate humor with illness and suffering, for those having to cope with chronic illness, a sense of humor and laughter may prove to be the best medicine, unquote. It is significant that several empirical titles work with the idea that humor and laughter may be the best medicine against pain. Here are some recent titles. Adams McGuire has the title, Is Laughter the Best Medicine? Benson et al., Laughter the Best Medicine? McDonald, A Chuckle a Day Keeps the Doctor Away, Therapeutic Humor and Laughter. Skevington and Allison White, Is Laughter the Best Medicine? Empirical inquiries into the use of humor and laughter in pain treatment apply to various persons from diverse ages and cultures in different pain conditions. How should we think philosophically of the empirical observations that humor and laughter can help us to cope with pain? That's my big question. So first I'm going to look at some philosophical concepts of humor and laughter, and then a brief look at the concept of pain. And thirdly, I'm going to look at similarities and differences between humor and pain. Finally, I will argue that it is because of these similarities and differences that humor can help us to cope with pain. So now to philosophical theories of humor. In empirical studies, humor is not clearly distinguished from laughter. The two most prominent contemporary theorists of humor, John Morell and Noel Carroll, and we also have Lydia Amir with us, I'm glad to say, will characterize humor as comic amusement at finding something funny. I think that's a broadly accepted kind of characterization. And laughter is a physical expression of such amusement. Now, let's be more specific. Some examples of laughter in stages of progress listed by Berg are, for instance, smirking, smiling, grinning, snickering, giggling, chuckling, chortling, actual laughing, cackling, fawing, howling, shrieking, roaring, convulsing, die laughing. We hope you don't reach that. Laughter can be humorous or non-humorous. What I've just read is actually, as such, I guess, somewhat humorous. Most theorists agree that humorous laughter expresses comic amusement. An example, finding a joke funny, or listening to someone ruin a joke, or watching a practical joke played on someone, or seeing someone in odd-looking clothes. Non-humorous laughter requires no such sophisticated sense of humor. It refers to physical behavior, such as in situations when infants or adults are tickled and die laughing. Morel and Carroll refer to theories of humor as theories of humor and laughter. And I shall refer to these as theories of humor for the sake of brevity. So to be in the same page, here are the main philosophical theories of humor in outline. Don't worry, in one sentence each, as we have dealt with this during the seminar series. The first, superiority theory, its main claim is that humor and laughter is an expression of a person's feelings of superiority. Second, the relief theory, its claim is that humor and laughter release repressed emotional tension by using some notion of expectations. Carroll, for instance, would say that a joke, for instance, builds up expectation, and when the punchline arrives, the pressure of the expectation is released and gives rise to laughter. The third and most popular theory of laughter and humor among philosophers seems to be the incongruity theory, which you all know. The basic idea behind the incongruity theory is very general, quite simple. We live in an orderly world where we have come to expect certain patterns among things, their properties, events, etc. And we laugh when we experience something that doesn't fit into these patterns. According to Morel, none of the three theories are on its own sufficient for a general theory of humor and laughter. However, each of them brings to the fore important features of humor. Comparing these theories, Morel suggests two general features of humor which can form the basis for a comprehensive theory. The first feature is what Morel calls the sudden change, or shift, if you want to, of a psychological state involved in laughter situations. Change, so he argues, can be primarily cognitive or affective. It can be primarily cognitive in accordance with the incongruity theory, when there's a sudden shift from a serious state of experiencing things that fit into our conceptual patterns to a non-serious state of being amused by some incongruity. And then the change can also be affective. This happens in cases described by the superiority and relief theories. In such cases, for instance, laughter accompanies a boost in positive feelings, the cessation of negative feelings, or the release of suppressed feelings. That is Morel. Now, the second feature necessary for laughter is that the psychological change or shift that I just discussed is felt as pleasant. So as Morel puts it, enjoying self-glory, being amused by some incongruity, releasing pent-up nerve energy, all these feel good and can cause us to laugh. An unpleasant psychological shift, on the other hand, will not normally lead to laughter. A necessary condition for humor and laughter is therefore that of a pleasant psychological state of amusement, a mental state of finding funny. Morel thus identifies central features of humor and laughter to combine the three major theories into a comprehensive theory of humor. And more recently, Morel, like Carroll, also identifies the play theory of laughter, which one could and should add to refine his comprehensive theory. Unlike the superiority and incongruity theories, the play theory explains the link between humor and the facial expression, body language, and sound of laughter. It also explains why laughter is overwhelmingly a social experience, as those other theories do not. Morel's proposal of a comprehensive theory of laughter and humor finds support in similar attempts such as Carroll's to identify and combine different features of laughter, respectively emphasized by various theories. In sum, one can say humor is about finding something amusing in a pleasant way because it is incongruent or gratifying, self-asserting, or playful. So if you combine all the theories, this is what a comprehensive definition would look like. Such a comprehensive theory or definition of laughter and humor claims to account for its complex physical, emotional, cognitive, and social aspects. All right, now I move to philosophical theories of pain. The official 2020 scientific definition of pain, introduced by the International Association for the Study of Pain, defines pain as follows. I'm quoting, it's an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. Now, three of these aspects in this definition are singled out by most philosophers of pain. The three aspects I want to single out, which I think most philosophers of pain have in common, are firstly, pain has various complex qualities. Secondly, it is a disturbance. And thirdly, it's unpleasant. Now, let's look at the qualities of pain first, the complex qualities. The well-known McGill and Melzack questionnaire for pain suggests the following groups of qualities of pain, which many theorists use in clinics, but also in philosophical theories. So the sensory qualities are, for instance, burning, flickering, quivering, pulsing, throbbing, beating, pounding, jumping, flashing, etc., etc. There are a lot more. Affective qualities such as tiring, such as tiring, sickening, suffocating, terrifying, killing, blinding. And then there are evaluative or cognitive qualities, and they include a very short list, annoying, and unbearable. So much for the complex qualities of pain. Secondly, pain is a disturbance. So mainstream theories of pain claim that these pain qualities are disturbing in some way. So there are three main theories, I think. Representationalism is the first, and it claims that pain is about a bodily disorder, typically tissue damage. And then there's imperativism, which agrees that, but adds that pain is about what a bodily disorder commands you to do. For instance, if you have a bodily disorder such as tissue damage and injury, one would seek protection or recuperation. And then there is the third theory, mainstream theory, inactivism. Pain is seen as a disturbance of our alignment to our environment, others and non-others. Phenomenologists, which I'm particularly interested in, refer to such disturbances using many different terms. Heidegger, for instance, speaks of a rupture between oneself and one's environment. Sartre refers to an alienation from one's own body and environment. And more recently, Leder describes pain as intrusion, scary as unmade from the world. So this brings me to the third characterization of pain. So pain is not only having a complex quality, it is also unpleasant. And it's not also only disturbing, but also unpleasant. Let me just ask, I see that my connection might be a bit weak. Can you still hear me well?
Yes, we can hear you at the moment, Abraham.
All right. So mainstream philosophers of pain are Armstrong, Tighe, Cutter, and Bain, call the painfulness of pain what makes it feel unpleasant, or bad, or bothersome. So the different qualities of pain are in some way or the other, so they believe painful or unpleasant. My own view, I think, pain is complex, and the sensory, affective, and evaluative cognitive qualities of pain are in each pain we have in very different ways. So firstly, I think it's complex. Secondly, pain is always in some way disturbing, no matter how little, and on what qualitative level. And thirdly, whether pain is unpleasant or bad or bothersome depends on what one has learned to habitually associate with the experience of pain within a very particular social context. One may, for instance, deem pain inflicted for cultural reasons effectively unpleasant because it hurts, but one may not take it on a cognitive or evaluative level as bad, for instance, if it fulfills certain rites of passage. So I'm turning now to similarities and differences between pain and humor. Comprehensive theories of humor and pain show strong similarities and differences. First, the similarity. First, both humor and pain can be considered complex experiences. Recall, the comprehensive theory of laughter claims to account for its physical, emotional, cognitive, and social aspects. And recall that qualities of pain are physical, sensory, affective, emotional, and evaluative, cognitive. So humor and pain share that they are complex, affective, emotional, physical, and also cognitive evaluative experiences. Compare, for instance, what we might consider very basic experiences of laughter and pain. Imagine an infant's experience of a tickle that causes laughter. Compare that to a slight bruise that causes a twinge of pain. The meaning of such experiences develop in complexity over time. Thus, we develop a complex sense of humor, for example, as we learn to play with concepts, such as in telling jokes, with wordplay. Similarly, we develop a complex sense of the meanings of pain as we learn to apply concepts habitually associated with pain. For example, as we learn to apply terms for the qualities of pain, such as burning, cutting, terrifying, etc., to express the meanings of our pains. The first characteristic, thus, is that humor and pain are complex experiences. That is what they share. Now, there's a second characteristic that I think they share, and that is that both humor and pain are disturbing experiences. More precisely, they are experiences of incongruity. We laugh because we find something funny, and some event goes against the usual meanings things have. One can adopt Morel's idea and say humor always involves a sudden shift of experience. Sorry, I'm just getting wrong call here. This should cover also laughter because of relief, because relief goes against patterns of tension, or laughter because of playfulness, because it mocks ordinary seriousness, or even laughter because of feeling superior, because it goes against ordinary feelings about ourselves and others. Pain is likewise about incongruity. If we take pain to be about disorders, it is clearly about what is out of order, out of the ordinary experience, disturbing, incongruous. Pain is always in some way disturbing the order of things, whether it's due to physical injury or psychological factors such as distress because of the injury, or social factors such as the interruption of our social activities due to the injury. All right, these were commonplaces between pain and humor. Now the difference. There's a big difference between humor and pain, such that we can speak of opposite experiences. We laugh when it means we find something funny. We are not amused when we feel pain. Humorous amusement is pleasant. Pain is unpleasant. Human laughter expresses pleasure in incongruence, gratification, enjoyment, or playfulness. Being unpleasant and disturbing, pain is typically, in some way or the other, unpleasant. Most philosophers agree on this, and I shall go by that agreement here, but note some philosophers disagree. Now, my big question, is humor the best medicine? Or how can we say that? How can humor be the best medicine, as the titles of some empirical studies indicate, to be more precise? Now, this last section will address this question by giving three possible philosophical responses to the empirical observations that humor and laughter effectively can help to manage pain. My basic underlying argument in all three cases is the following. Humor and pain So I tried to show are in opposite ways experiences of incongruity. In humor, we are pleasantly amused by incongruity, and in pain, we are unpleasantly disturbed by it. We laugh when we are pleasantly amused by incongruous patterns or expected meaning. And we are in pain when we are unpleasantly disturbed by the incongruity of potential or actual disorders. In both cases, we experience a disturbance of the usual order of things. In humor and laughter pleasantly, in pain unpleasantly. In short, humor and pain are respectively about pleasant and unpleasant disturbances of the order of things. Now, my contention is that it is because of both the similarity and difference between humor and pain that humor can help us to cope with pain in three possible ways. There may be others, of course, but here are three possible ones. First of all, I think humor can be a control breaker. It can break the control of pain. Consider the terms and phases of laughter listed before. Consider moderate smirking, smiling, grinning, giggling, controlled chuckling, chortling, cackling, uncontrollable howling, shrieking, roaring, and convulsing. All of these acts of laughter in more or less humorous manner go against our normal patterns of controlled behavior. Human laughter thus makes us experience the uncontrollable. Pain, on the contrary, typically makes us experience disturbances in what one might call alert mode, controlling our behavior. Even minor pains caused by cuts and bruises put us in an alert mode, as Patrick Wall called it. He's a famous pain neuroscience theorist. And his view is that pain absorbs our attention and we seek with urgency ways to alleviate it. This is what he calls the alert mode. Serious pain may control us then by negative feelings. Its intensity may swallow us. Its gravity may engross us in desperate attempts to escape it. Now, my argument is that humor breaks the control of pain. And here's the precise argument. When we are disturbed by pain, we are sensitized and more likely to be disturbed by other unpleasant disturbances, itches, sharp light, noise, etc. In pain, we are very often oversensitized and can't bear sharp light or noises. Likewise, we are also disturbed by a pleasant disturbance, such as of humor and laughter. In pain, one does not feel like hearing jokes and laughing. But being a pleasant experience, laughter accompanies a boost in positive feelings, a cessation of negative feelings, or the release of suppressed feelings. If humor manifests as pleasant disturbance, and we are sensitive to disturbances when in pain, then we can expect the pleasant experience of humor to have a positive disturbing effect on us. So the effect will be to boost our positive feelings and so to break the control of pain and its overwhelming negativity. So for that reason, my argument is that pain controls us negatively, but humor, on the contrary, is a control breaker, as it disturbs the negativity by boosting positive feelings. It's basically a disturbance of a disturbance. To minus, make it positive, to put it in mathematical experiential terms. One may ask, who can control die laughing, even if you're in pain? As such, laughter can be a painkiller. Now, I tried first to show that humor can be a control breaker. Now, second, I would like to argue that humor is also a liberator from pain. Morel rightly argues that when we find an incongruous situation funny, we disengage from doing anything in that situation. He considers, for example, someone grumpily pouring the morning coffee over the cornflakes. If such a person would laugh rather than swear, he or she will be able to step back from what he or she has done to enjoy its bumbling absurdity. So humorous laughter is thus valuable in giving us a particular distance and perspective in situations where we are feeling troubled. So you asked why I started doing studies of humor. It is because I've, in very particular situations in the Fort Harean context, seen how deanery in troubled situations would start laughing, and it would distance us all from the problem at hand. So now humor can all the more, I think, be used to detach one from the grip of painful situations, not only troubling but painful situations, even if it might only be for a while, right? This applies to very serious cases of suffering as well. As Morel writes, in some cases, such as during wartime, and we have some wars going around the world, humor can become almost a prerequisite of survival. And he's quoting Viktor Frankl on being in concentration camps. Unexpectedly, most of us, so Viktor Frankl writes, being in Auschwitz, unexpectedly, most of us were overcome by a grim sense of humor. We knew we had nothing to lose except our ridiculously naked lives. Humor was another of the cell's weapons in the fight for self-preservation. Humor, more than anything else in the human makeup, can afford an aloofness and an ability to rise above any situation, if only for a few seconds, unquote. As the empirical studies shown, such overcoming of painful situations applies also to hospitals and nursery homes, where children and older adults find themselves in diverse conditions of pain due to illness, surgery, chronic disorders, and distress. As Berg observes, positively, laughter improves self-esteem, restores hope and energy, and provides a sense of empowerment and control. And this manifests psychically and physically. One could take this positive effect of laughter as a manifestation of the liberating distance and detachment that laughter and humor provide to free patients from the dominating effect of suffering. So up to now, I've tried to show that humor is a pain control breaker and liberator. Thirdly, I want to argue that humor is a social facilitator against pain. Benson et al. Established that humor can soften the self-absorption and isolation experienced by both patients and staff. I quote them, when used sensitively, respecting the gravity of the situation, humor can build the connection among the caregiver, patient, and family, unquote. Among others, Dunbar et al., another researcher who is quite prominent in writing on such issues, suggests that within an empirical framework, they suggest that humor and laughter through an endorphin-mediated opiate effect may play a crucial role in social bonding. Now, much of these empirical findings can be served well with a philosophical reflection on the social role humor and laughter play as detector and facilitator of incongruity. So back to philosophy. Humor and laughter, so I try to argue, facilitate social interaction in situations where they express and endorse a playful way to deal with conventional communication. Muriel puts it nicely. In humorous conversation, we might play not just with reality outside the conversation, but also with the very moves of conversation itself. Such conversation might, for instance, happen among patients or staff in hospitals who might playfully violate the convention of serious conversation by mocking or kidding with each other, or by joking about their situation. If done with all due sensitivity, and this is emphasized by all empirical studies, if done with all due sensitivity and consent, so laughing with, not laughing about, such playful dealings with serious situations can have a bonding effect with strong therapeutic value. Thus, humor can detach one from one's personal suffering in a way that may help one to take it less seriously and find it more bearable. And exactly this is demonstrated by empirical studies. Ultimately, humor helps us to see and bear incongruities as belonging to social life and life in general. And by laughing together, we may find a way to resist and even celebrate incongruity. In fact, humorous laughter even helps us to see that nothing is to be taken all too seriously, not even something as serious as pain. Not that humor denies pain, but rather it puts it in perspective. The perspective is, in the long run, that life, and I'm quoting Pascal, with all his pleasure and pain, is not ruled by reason, but by folly, in a way that we can actually call funny. I'm closing here. Ultimately, by switching to the perspective of humor and laughter, one also turns the meaning of pain. So if pain loses its stronghold, we can laugh together about our pain. It certainly decreases its intensity and it will be less disturbing. Call it the communal power of humor in suffering. Communal power of humor in suffering. Thank you so much.
Abraham, thank you. There's I have a whole lot of questions to ask you, and I see Jenna does too. And anybody else who would like to ask questions, just what is the word? Put it up in the chat, and I'll switch to you, or stick your hand up as Jason has, and then I'll invite you to speak to the questions. So, and Jenna and I generally hold back and leave ourselves for a while. So I think let's ask Jason and then Lawrence to come up, and then we'll take it from there. Jason, hi, good to see you.
Hi, thanks. Thank you, Abram. So I was just thinking about the idea that pain is aversive. We seek to avoid experiencing it. And there isn't a perfect parity with the way we chase humor. We don't, and I think that's due to complexity. But what this got me thinking about was the idea that when you said that our control places a demand, an exhausting sort of a demand on us when we're in alert mode, which made me think about the idea that it's the bandwidth. I read a sociologist recently who talked about the bandwidth hypothesis of stress, that it's the demand it makes on our cognitive modeling. Like even something as simple as I pressed garlic underneath my fingernail and now every time I touch something it hurts, that sort of thing. It places an undue demand on our modeling of our engagement with the world, which becomes stressful. So I just wanted to, I wondered what you think about the idea that there may be an endorphin-based response that addresses the moment of pain itself, but it sounds like what you're saying also maps this distinct thing where the lack of control or the recontextualizing of something that demands our attention is a relief from the idea that we're forced to give a certain possibly exhausting amount of attention to something. And that what that sounds like to me is it might be the stress of needing to attend is the thing that's released. So I just wanted to say, it sounds like there are two things. There's the endorphin-based relief from instances of physical pain, and also that you're pointing to a relief from the stress of being forced to attend. And I don't know quite how that other mechanism with the relief from recontextualizing works, but it sounds fascinating. I just wanted to note that it sounds like those two distinct things are what you're pointing to.
So absolutely, you've summarized very well, Jason. I couldn't do it better. So you basically answered that question. So I can take it as a comment. But well, so the two moments are positive, but what is positive, and this is where I come in, I think you were uncertain about that component. So the
let me note what hangs from that
is from the disturbing factor. So the fact that laughter disturbs the disturbance. In this sense, it breaks the control. It makes you stop. Being in the light for a moment, at least.
What fascinates me about what you're saying is that I don't know if I'm very clear on what the mechanism is that makes that recontextualizing work, and I think that's a sort of an ongoing thread that hangs. But yes, sorry. So in that sense, that question of how do we understand what that moment of break is and how it shifts our focus, yes. That seems like still an open question. But so I wasn't just trying to summarize. Sorry.
Well, okay.
Thanks.
Well, in trying to ask, I think you have an implicit answer there. So that I think what I try to do, but perhaps it's not clear enough yet, is to work with the concept of incongruency and then also disturbance. So, but in both cases, we have the same kind of structure in opposite ways. One is disturbance in a pleasant, the other in an unpleasant way. And the disturbance is one of going against the order of things. But one disturbance captures, you can't control it. The other one releases you to be able to control. And what strikes me is that it's almost a kind of mathematical experience here of two negatives. Is that one disturbs the other disturbance and breaks it open in a sense. So I didn't put it in this way, but you can say, if you want to be funky, you can say laughter and humor are disturbances of a disturbance, and a positive disturbance of a negative one. This structure, this bringing things out of control, when one is under control, is what breaks open the positivity effect. That means the possibility that there is a boosting effect.
Thanks. I think that lends itself to the cognitive modeling idea, where the idea is we get locked into a particular model, and it's right. the breakage means we have to reassess very quickly. So thanks, that really helps.
Great. Yeah, thank you. It actually is fascinating. Lawrence, and then we'll go to Lydia after that.
Okay. Thank you very much.
Hi, Lawrence.
Will I say a little bit excited about your comprehensive theory of humor, which I believe takes care of the extant theories that has tried to explain this universal, culturally universal phenomenon. But I think my worry is whether our claims on humor, especially when it has to do with the psycho-social aspects of it, pain, anger, and all that, whether it recognizes the different temperaments of human beings, so I don't know, do we really recognize that what is humorous to one person might make the other person angry? In other words, when we talk of humor and objectify it, are we not trying to, if you like, underplay some aspects of the components of the human being that also come into play in the relevance or who does humor appeal to and why and when. So I don't know whether Professor Olivier could maybe help to lay emphasis on that or tell us how much we could think about that, you know. Who does humor appeal to? If you're analyzing humor, for example, to the choleric, to the sanguine person, or other aspects of temperament that define us as human beings, could there be different effects of humor on individuals based on that? Or can we assume that generally our claims about humor could apply to people across board?
Thank you, Prof. Kwani. So I think I tried to address that aspect of individual experiences and subjectivity by calling both human pain complex. So both have complex qualities. So that's the one thing. So there's a long list of, like I indicated, of terms which help people, the McGill list, to help people identify their pain. I think there's a long list of words for laughter, which I pointed out to help people describe their laughter. I think both indicate that there are many terms because people have very different experiences, complex experience of laughter, and one may not, so one term, smirking or laughing, and the other one, cutting or searing, may apply in one moment to one person and in the next moment not anymore. For instance, stomach ache may be searing right now, and a bit later it may have quite another quality. It may be cutting. So even within one person, there are many different qualities at play, and the same with laughter and humor. There are different moments in which we experience different manifestations of humor. You may smirk about one thing now and later just chuckle about it. And the very same goes for other persons. So there's a vast difference between persons. My theory is yet that we learn socially to apply these terms. And we do this in particular contexts we habitually associate with these terms. So there is also a shareability of these terms between persons within particular contexts. And this is why people, I think, sometimes just quickly catch each other's sense of humor. They look at each other and can laugh. This may happen because they have similar experience within particular contexts. And you have in particular countries humor about particular contexts. So one in North Germany, for instance, I would make jokes my Southern German students would not understand. The North and South German sense of humor are very different. I think the same goes for South Africa, and we've seen it in the series as well. So I think there are contextual similarities, and people share them by associating particular terms and descriptions to their laughter. So it's not just a universal theory. Rather, I take very seriously the complexity of human laughter. If I speak about disturbing factors, things they have in common, I think I'm working with the theory I have, but this does not disrespect the qualitative differences and contextual differences. I hope I answer your question.
Thanks, Abraham.
Yes, thank you very much.
Okay, great. Thanks, Lawrence. Lydia, let's hear from you.
Hey, can you hear me? Can you hear me well? Yes. Thank you so much for a wonderful talk, and especially for emphasizing especially the relationship between pain and humor, because usually the emphasis is on laughter and pain, laughter as a bodily phenomenon, which is actually one of my questions to you. For example, you know, there is yoga laughter. Would yoga laughter, laughing together, or alone for 20 minutes each day, even in pain, without humor, without incongruity, except the incongruity I'm in pain and laughing, would have the physical benefits. Because I have read a lot of articles that emphasize the physical benefits of laughter and their influence, not only with endorphins, but other movements in the body on pain. So this is one thing. I do not associate laughter with humor necessarily. In my case, also humor is self-referential humor, you know, and self-directed humor, you know, some thinking that you may have in seeing the comical situation or the incongruous or not even necessarily spontaneously funny and not sharing it with other people. So this is the other side, is that laughter, of course, has a wide range regardless of humor, as you may know. And humor has a wide range that I try to develop regardless of laughter. It may be still social. It may be that we have interiorized society, but you don't laugh, you don't even smile outside. Now, these are some general comments, not to minimize what you've done. And in order to maybe contribute to what you've done, I think that we are naturally in a normal situation that we call healthy, incongruous beings, incongruous between us, in ourselves. You know, we have a body and we are a body, if you want. And between ourselves and others, and between ourselves and the world. And in pain, we are in a situation of congruence. Usually, congruence is considered to be aversive to laughter, but we have examples of congruence only on the opposite side, of utter pleasure. Religious, for example, the religious state in Kierkegaard, or I don't know, Schopenhauer example that I read yesterday, that the animal does not laugh, and the seriousness that is involved in pleasure when we have a sexual relationship, which is the seriousness of the animal. So I think that in pain, we are congruent. We are trapped in our body. We are only body, and all our attention is there. So any case of incongruity, any case, someone saying something or seeing something or being able to listen, to see that there is the possibility of incongruity, will give the beginning of a distance that we call freedom from what Yankelevich called the tragic, which is the impossible yet inevitable. Yes. So pain is the utter example of the tragic. It's inevitable, at least this is what we think or feel at that moment, yet impossible. And anyway, you move a little bit with the comical, not necessarily laughter. Yes, the comical view, you begin to either find it not impossible or not inevitable. And this is actually putting in practice the Epicurean idea that if pain is chronic, you can have some amount of pleasure at the same time, but you have to break that congruency with yourself.
Right, so thank you very much, Lydia. I appreciate these tricky questions. So let me give it a shot. So yeah, if I speak about pain, I presumed, I should have said that I thought you could understand, because I've spoken that way about physical pain. But all pain, though physical, have also sensory, but also affective qualities and evaluative cognitive qualities. That's very important to me. So even though you may be absorbed by your body, as you pointed out, and you call that congruity, and that should work, you are trapped. Even in such a moment, there are moments, affective qualities and also evaluative qualities in play. And my argument against mainstream philosophy is that you can never have a single quality covering everything. You can't have a single affective or sensory quality covering everything. For instance, unpleasantness, that doesn't work. So in some way, all these qualities, affective, sensory, cognitive, evaluative, are present, which means there's not only bodily pain that traps us, we are rather susceptible to be, I think, influenced on another level, affective level, for instance. So in case of laughter, you're right. Laughter is a physical expression. It's easier to see how it, with the endorphin kicks, will disturb the monotonous pattern of pain, which you call congruity. I just call it incongruity because it's so disturbing, but that's a matter of terms. I think we may agree there on the same issue. So the point is here that it is not that only laughter physically can impede physical pain. It is rather the case that pain has different qualities, and so also humorous laughter. So while laughing, there is a sense of humor. There's a cognitive aspect, a social aspect. All these aspects are always there. This is my own theory. There's no single affective moment or physical moment. Morel himself thinks laughter has nothing to do with emotions. And I offered an essay for you to argue against that. No, I think laughter always also involves emotions, and the same with humor. So they're very complex experiences, and this is my kind of argument. And I think because of that complexity, and I was not clear enough on that, I really thought that this morning, because of the complexity, different aspects, different qualities of laughter and humor can influence each other. Otherwise, we are really only trapped in the physical, emotional, or cognitive. I think perhaps one last remark. Morel is very focused on the cognitive shift in laughter and humor. So you understand with humor, cognitive shifts, but you may not laugh about it. I think there's always something effective in a cognitive shift also, and sensory. I mean, when I read those terms, smirking, chuff, of laughter, I can't even remember them now. There's something funny about them. We cannot but laugh because of funny concepts. There's an effective physical moment, and I think this is what helps us to get that burst that disturbs the monotonous patterns of pain.
May I add something that following what you're saying, and I forgot to say earlier, I think that humor is the sole tool that we know of that teaches us proportion. There may be others, and proportion, you know, it goes well with your theory. It's a very complex thing. It may be the main thing that we need to have and to learn, and we don't know of another systematic tool. So this is to answer the gentleman question before. We do not like to be put in proportion or reminded proportion or taught something by someone else against our will. If we are in too much pain or we think it's the worst thing in the world, we do not want this to be put in proportion. So we have to agree, we have to get along, we have to yearn for proportion in order to laugh along or to even initiate something. And sometimes if something that is accidental happens that makes us smile, yes, out of pain, you know, then we may be put in proportion without our own will, but we are not angry about that. Then we see a way out. So I wanted just also to point out, because a sense of proportion is also a very complex mechanism that Pascal also, if you refer to Pascal, tried to talk about. We have a problem with that. We don't know the scale, and it involves values, of course. And this is what we may resent if it comes from the outside. Yes, the change of values.
Yes, thank you so much, Lydia. That's a good point.
Yeah, I also agree that yeah, laughter to teach you proportions, that's really fascinating. That's something I need to look at more carefully. Jenna, would you like to, I know you said you have a few questions. There you are.
I do. Thanks, Andrea. Thanks very much, Abraham. I thoroughly enjoyed your presentation. I do have a couple of questions. Okay. For someone who suffers from chronic pain, I can say I have tried to use humor, and it has only ever served me as a form of relief in relation to Freud, a distraction, a relief of pent-up energy. So I want to know, does it take a certain type of person to implement humor's benefits or humor and laughter as a method of pain relief? And relatedly, are there certain types of pain that can be relieved by humor and laughter? And in what sense or in what capacity would humor serve this person in chronic pain? And in what capacity would laughter? Because Lydia mentioned laughter yoga, and I myself have heard of it. So would it be the actual physical act of laughing that relieves pain? Or when you speak about humor and pain, would it be someone having a sense of humor in order to cope with, you know, like the cognitive, affective, and physical manifestation of pain? I hope that's clear enough, Abraham.
Yes, thank you. Like I told you at the beginning, I'm only going to disappoint you because I don't really have answers on these things. So let's rather discuss them. In the case of chronic pain, you're speaking from personal experience. I'm very, hesitant to try to give a philosophical answer to these things. But people go to doctors and they find no help. So we philosophers are called upon.
Yes.
So how do you laugh then, right? Let me start with the last question, basically. There's something they call pioneer science education. They have not yet brought in laughter there, but it's like cognitive therapy, learning to use particular concepts to influence pain. So if people fear pain, they will suffer more.
Yeah.
And I think on the same level, concepts can play a role in addressing concepts of laughter, concepts of humor. And there we have different concepts, jokes, for instance. And we come to laughter and human differences, but I think conceptually they can play a role. Why can they play a role? Once again, my argument for the complexity of the qualities of both humor and laughter means that that very different qualities of experience in very different moments, in very different situations, with very different persons, may play a role here. So there may be particular moments where a particular kind of laughter may help physically, and another one where humor, where you have a cognitive shift, may help a bit. So I also like to speak about episodes here. It's short-term relief in terms of chronic pain. There are breaches, and so there are different evaluative, cognitive, and sensory moments in which pain, in very different ways, concepts of pain and laughter might play a role. So that is what the pain neuroscience kind of take would bring in. The concepts can play such a role, not only because of the cognitive therapeutic power they have, but especially because all concepts, and this is my own take, are embedded in situations where we use them to express complex experiences. So concepts live off, they're parasites of affective, sensory, and other qualities we all have. These are the major ones people like to speak about. So I do think that concepts can play that role, not only because we learn to discipline ourselves to find something funny, but because the concept speaks to finding funny, and we cannot but. So, a joke is a wordplay, and we learn to find it funny in stress situations and perhaps later in pain situations. So I think in yoga, there may be laughter therapy. I think there can be conceptual laughter therapy as well. Humor therapy. Yes. Conceptually. So this is how it addresses. So in your own case, this might be new, but I think it might be necessary to explore the possibility of pain neuroscience laughter conceptual therapy or humor therapy. And laughter and humor are different. One is physical. You will have yoga, yes, it will have another effect, but it will always in some way be attached to our emotions, our conceptual understanding, and our humor. I mean, you find funny when you laugh, isn't it?
Yes.
Contrary to perhaps an infant. I tried laughter therapy with myself, and you find basically funny that you laugh. It's humorous. So it becomes a humorous situation. So I think it's very difficult to just separate them very strong like Memorial does, so that one is just this expression of the other. So laughter is an expression of humor. I think it's more complex than that.
Absolutely.
This complexity is helping us to find little breaches, openings, gaps to address something like chronic pain that goes on. But there's not a long-term big answer. I'm trying to advocate the episodes, the moments in which different qualities of laughter and pain and humor may be able to break into monotonous many qualities of pain.
Yes.
I don't know if that is helping a little bit.
It does, absolutely, Abraham. And I like the idea that you mentioned about human neuroscience and that. So it would be something that has to be taught and learned and practiced. Is that what you're saying, how we could benefit from the humor? Because laughter therapy, laughter yoga, I can sit here and just burst out laughing. And I can have, the physical benefits of that. But the humor side of it, I understand what you're saying. It's something that can be taught and learned and habitually practiced in order for you to benefit cognitively, emotionally, and physically. Because at the end of the day, like you say, in many cases, humor does precede laughter. Laughter can exist without humor, but they do go back and forth. So yeah, brilliant answer. Thank you very much.
Okay, Jenna, thank you. Also, excellent questions. We have unfortunately run out of time, so and we could carry on talking about this. I think one of the big takeaways from this presentation is that it seems like you can't take laughter as a pill for pain, but you can preemptively create situations in which you learn to be humorous and you learn to laugh, and that could be a kind of as you say, small breaks in between or small breaks in between pain. I don't know if that really makes sense, but I think that for me is an enormous takeaway. And thank you, Abraham. I think that there's very interesting work here, and I think, yes. So what I would like to just mention is that next week we will not be having a seminar because we will be doing a conference. But the week after that, we will pick up again with the next presentation. So thank you very much, Abraham. We will see you soon.
Yes, next week.
Yes, next week, yes. Thanks everybody for joining us. Jenna, would you like a quick word?
I'm sorry I didn't get to ask Abraham more questions because I have a whole page here, but I just found it really fascinating and I've so been looking forward to the presentation. So just thank you very, very much.
Okay, all
You're
right.
welcome to meet. We can meet up and have video conferencing.
That will be fantastic. Thank you, Abraham. I will take you up on that. Thank you.
All right.
Okay, wonderful. All right. Thanks,
Bye,
everyone.
everyone.
Have a wonderful weekend, and we will see you in 2 weeks' time. Okay, cheers.